Hello, everyone, and welcome to the live webinar for expanding your practice through the use of orthodontic aligners. Today, we're going to talk about a very good topic that, is silly to think that even if you don't do orthodontics, you're not familiar with clear aligners. The main concern or the main point here is to see the journey, why and how we can use these aligners, this orthodontic appliance, to our advantage. I'm going to take you through a journey where I'm going to tell you where we are and how we got there. So, as I said, even if you don't do any orthodontics, if you don't use any orthodontic appliance, you're very familiar with clear aligners because of all the publicity, all the consumer-related advertisements that you cannot escape from. Patients, for the first time ever, come to our practice and request a product with a name, and that's never happened before. So we need to ensure that we make the most out of this. And the question is, if this appliance is so good, why not? Why not everyone is doing it? What is the issue? And I can only relate perhaps to the fact that when you go to dental school, at least in my experience, not very long ago, we will have a very heavy reactive curriculum on the dental faculty, where restorative elements, conservative, prosthodontics, where composite inlays, crowns, bridges, and dentures came as the main sort of aspect of the curriculum. And it was not only until the end of the degree of the course that you will have the orthodontics module. At least that was in my experience, and you will learn very little of orthodontics. And I actually can remember that when there were all the tracing and everything that the tutors required, I always had a bit of a, I don't know where I am with this tracing. I don't know what I'm doing this for. So I guess we were taught to build restorations on crooked teeth, right? I think you're probably familiar with this concept. And I think that's where we have been taught to obviously improve the appearance of the teeth. It doesn't matter if they were in the correct position. The objective was to improve the appearance, and if you could improve also the position by means of restorations, well done. That was a great achievement. I'm sure you're very familiar with this. I see this everywhere in Facebook, on the internet, when they are so very proud. I mean, I respect the skill that this requires from all my colleagues to prepare a full mouth restoration with veneers, ceramic restorations, but on teeth that are not necessarily in the correct position. So what will happen? I mean, I think the longevity of these restorations is questionable. So we are very proud to show our results. And as I said, I'm sure that requires a lot of skill. I don't do any of these restorations. I just do orthodontics now. But it's very complicated, of course, to achieve that. But then again, we are building a house. We are building our construction on crooked foundations that will definitely affect the longevity and the life of these restorations. And the function, of course, will never be improved if the teeth are not in the correct position. If we maintain traumatic occlusion or traumatic envelopes of function, but the anterior segment or the labial aspect looks incredible. So it's not the best. It's not the best approach. I mean, even so that when we create full dentures, we even, it's okay to give them a little bit of character, overlaps and things that look normal. So that refers back to what we've been taught, that it's okay to build on crooked, restorations on crooked foundations. So I question how many people will start or still consider doing these ceramic restorations on patients that present this appearance. It's unarguably it will be very, very invasive. The amount of enamel required, the amount of enamel reduction required to provide a nice looking smile without moving the teeth into the correct position on a patient like this, it's huge. This is scary, and perhaps a lot of endodontics required. So this is where we are, and I think we need to move away from that. And I'm sure a lot of people are moving away from that. They are conscious that wisdom doesn't just come from thermolars. And we're ditching the old ways to come into the new ways. And those new ways are related to, we need to put the teeth in the correct position for whatever they are and whatever they look like. We need to put them in the correct position. We need to consider the function of the aesthetics, first of all. And that will bring a lot of benefits. This is a clear example of what we're doing now. We have a patient that comes to our practice showing a moderate amount of crowding, more so on the lower incisors, but showing a restricted envelope of function, very constricted posterior segments and arches that are not wide enough, hence the anterior crowding. So before we even consider any restorations, these days we are offering a level of orthodontic treatment that perhaps not to be all the way to achieve class 1 relationship or perfect overjet, but at least to come out of that restricted envelope of function and allow the teeth to receive restorations that will not fail because of these traumatic occlusions, even though they look amazing for the first year or so. I can tell you, if you place any restorations on those lower incisors, for example, without any tightness interproximal contacts, they will be very, they're not going to last very long, that's for sure. So it's important to consider this element. And what we're doing now is we're providing with a little bit of orthodontic treatment. And as I mentioned, not going super, in the perfection of the approach. But certainly we achieve a nice position where, the patient actually stopped considering any veneers. There was a little bit of fixing of the crowns on the premolars, as you could see, but the patient was super happy with the anterior segment. There was a little bit of manicuring on the incisors, but as you can see, the teeth even look whiter just by removing the overlaps and getting the light have a better reflection. As you can see on the lower arch, it's not even finished, the alignment, but it's definitely better. It's definitely better, and patients are happier. And at this point, if you provide a treatment like this, and at this point you want to provide a restorations for any reason, it will have a lot more chance for a lifespan or a longer lifespan than before. So it's important to consider this approach with orthodontic treatment. But what are the challenges? Why is not everyone doing it then, if it's so good and simple? Let's talk about the orthodontic challenges. Well, the fear of the unknown, because as I mentioned, going back to the beginning, is not something that you learn in the postgraduate course very well, at least, as I said, not in my experience. You don't have enough time to learn everything. So you have a little bit of fear of the unknown, and also the fact that it's a very heavy, or used to be very heavy, specialist branch of the general dentistry. So it's difficult to break through. However, it's easier now, as we know. It is also difficult to convince a patient to wear brackets or fix appliances, and that's the normal therapy that we used to have. Obviously, convincing an adult with very high jobs, perhaps big lawyers or anyone that speaks in public to wear braces. It's not an easy task. So that is a challenge. Added cost to a restorative plan, of course, when a patient comes and wants veneers, and then you say, well, you can have the veneers, but on top of that or before that, you need orthodontic treatment. It's obviously a big challenge. What you may ask, well, if you have the orthodontic treatment, why would you have then the veneers? Well, the reason is obviously the orthodontic treatment will address the incorrect position, but if the teeth are uneven or asymmetrical, or the crowns are just not good, obviously you still need some sort of restorative plan. So adds to the cost, and that brings a big challenge, of course. Another challenge of an orthodontic therapy is that now there are too many orthodontic options. So it makes you, the fear of the unknown suddenly becomes too many options, and it's just a challenge. So it brings a challenge to your armamentarium and orthodontic therapy. That's why it's difficult. But then who's the savior? The savior is the aligner therapy, as we know. Aligner therapy has revolutionized the dentistry in a way that everyone is doing it, everyone is exploring it. Many people have a lot of bad things to say about it. A lot of people have a lot of good things to say about it. I think as long as you do it correctly, it's a great appliance, and it just makes everything simpler, more simple to align teeth and to bring everything into a more or less invasive approach. So when we talk about aligner therapy, of course, we need to consider also that it's very simple, right? You all you need is a intraoral scanner these days, 3D printer, and a pressure former, and then that's it. Voila, you have your aligners, and then aligners are made easy, right? A lot of people are doing it at home in surgery, and they're getting a certain amount of results. I don't know if I can say good results, bad results, but they having aligner therapy made easy. What is that? Is that the thing, right? Is that all we need? Is that all we need? These machines? Unfortunately not. Aligner therapy has its own challenges, and they are mainly related to the fact that we are facing a world of dentistry that everyone is claiming to do digital dentistry. We have, as I mentioned before, a lot of options, a lot of providers, and every day more and more providers are claiming to have the best aligners, the clearest aligners, the fastest aligners. So it becomes a burden to really understand whether you are submitting a case or you are dealing with a company that is going to provide predictable solutions. Furthermore, to make it even more challenging, we have an added issue, I will say. I don't know if you have heard of the Smile Direct Club. Basically, we are not needed anymore, so the patients can have their aligners bypassing any provider. So if the orthodontists were a little bit, I wouldn't say angry, but upset that normal general doctors, they started doing orthodontics, well, they're going to be even more angry now, because there are companies that obviously submit impression kits for patients to take their own records and then send them to them, and then they will obviously very cleverly create the clear aligners needed to straighten their teeth. So that is a challenge for us, because how can you convince a patient not to do that and come to see you instead when it's obviously more expensive, and with all that, when it sounds cliche, but that fear of the dentist. So it's hard. It's a challenge that we encounter now. So this is what we're fighting against. The patient has all this information, as I said at the beginning. Even if you are not doing any orthodontics, you haven't been able to hide from all of these adverts that you see, Smile Direct Club or any other companies on TV, newspapers, and everything. And patients obviously be very easy attracted to that. The problem is that media, and as you know, fake advertisements will lead them into a incorrect option. You see many advertisements in the TV newspapers that will promise everything, but it's a challenge, right? It's a challenge to convince the patient that they're actually not providing the correct appliance needed, because the appliance that is needed is not just an aligner, right? It's a whole plethora of teamwork integrated into this appliance. One of the challenges as well is to understand what appliance will actually take you from beginning to end in the most straight line, and that requires a lot of skill. And I'm going to talk about it later. But yeah, as you know, it's called predictability, right? How easy will it be, or how fast, or how straightforward will be to take you from the beginning to the final position that you predict? And that is the challenge. There's, you know, in the digital world, everything can be recreated. You can have and submit cases, and if you're not aware of what is correct, what is possible, what is, as I call it, cartoon odontics, you have the risk of approving the production of an appliance that will never work, you know, that will never give you the results that you expect, and then you are left wondering, what am I doing wrong? It's obviously me. Or some doctors say the appliance doesn't work. It's very easy, but it's a combination of both. It's a combination of appliance and skills from you and from the team that you are working with. So it's important to recognize the predictability on the planning, of an appliance, that the movements that you planning digitally are actually going to be replicable in the real world, not just cartoon odontics, which is very easy to move a tooth from one side to the other in a software and go from a class 3 to a class 1 magically. But that's obviously not necessarily the reality that you will see clinically. So what is the next option? You need to find an expert, or you need to ask an expert, and that's what you know, people start getting more and more disappointed with these aligner therapy challenges, because everyone claims to be an expert. That's the other issue, right? You have tons of posts. I mean, I love the social media and all the groups that you can see on Facebook and everywhere, but it's so difficult to know who you need to listen and who actually has done it, who's telling you the truth, who's just claiming to be an expert or not. And that is a challenge. So, I mean, I'm sorry, we're talking about all the negatives, right? But trust me, that's to move on to the positives. It's just important to recognize the challenges that you have out there. So what is there to do? How are you going to overcome these challenges to achieve a good, or to obtain a good aligner that is going to provide the best approach? So let me give you a little guide of when selecting an aligner company. You need to think of a predictable planning, that whatever you see on the digital plan, if you have a digital plan, or if the company offers a digital plan viewer, that whatever you see on that, it's actually going to be replicable in reality, so that you can trust that the planning that is done in the company is done accurately. So, for example, with 6 Months Smiles, you have set up by technicians using the state-of-art software. This is the typical modification and segmentation of your 3D model or your STL file that when you clone your patient digitally. From there, you have to rely on predictable planning by doing it by people that actually know how to move the teeth and where the teeth are going to be positioned predictably, and the journey that the teeth are going to have from beginning to end that actually makes sense biomechanically. So it has to be done by a person. There's a lot of hopes and pushes to put all of these algorithms into artificial intelligence. However, it's very difficult to do that because case by case is completely different. And as I will explain later, we're not just working with 3D models in occlusion. So these models then, once they're planned, they're reviewed for quality and predictability before you even receive them. So that is very important. It's very important for somebody to, with a lot of experience, to check if those movements are actually going to be achieved. And if that plan, if that final position makes sense, not just for the visual aspect of the models, but makes sense clinically with everything that the patient comprises. So it's important to have that on your predictable planning. Obviously, customize a treatment plan with future restorations in mind. If you have, as I mentioned at the beginning, a plan that will require after orthodontic treatment some restorations, you need to keep that in mind. And the planning, the company that you're using needs to be aware of that and capable to take that on as well. So it's all about the science within the biomechanical staging. It's all about not just moving teeth with a digital software that will move teeth wherever they want. So it needs to be implemented with some science within that stages. You don't want to end up seeing something like this when you do your treatment. This is something that is not even considering the clinical element of the patient, what the patient presenting. It's all about aligning two sets of models, which is just crazy, right? You will never provide that to your patient. So this is an example of that particular patient that a colleague of mine clicked yes, and they called me and said, George, what's happening here? So, oh dear, when you see that, you think we definitely need to implement in our planning a good orthodontic assessment. It's not just about 3D models looking good on an aligned arch, following a nice arch line or arch wire. Needs to be assessed with all the orthodontic assessment, with all the ins and outs that a smile comprises related to the biology of the patient, the face, asymmetries, planes, all different aspects that will represent and will constitute the correct orthodontic approach. So it's important to consider that the planning needs to comprise all of this. Otherwise, you have a massive risk of failure, and that's the challenge, right? That's the challenge when planning and when using an aligner company. So that's within the predictable planning. What about the actual material? Of course, as I mentioned earlier, you just need a scanner or some impressions, and then a printer, a 3D printer, a pressure former, and some material. There are a lot of differences out there in the market with materials. One of the most important aspects is if the plastic, this is a plastic that you use for your aligners, is going to deliver the forces for a long time, because that's what you want. It's a removable appliance. So if an appliance, a removable appliance, when it's in, it doesn't have the forces, the continuous forces for a long period of time, then the teeth, or whenever you move teeth, they're just going to go straight back to their initial position if the forces don't last long enough for for the bone remodeling system to action that movement. And of course, we use actually a very good material called Duraflex, and it's proven to be a really comfortable material for many characteristics that the way it's made. But more importantly, it gives a longer period of force for a longer period of time of forces, continuous forces, at the same time as being comfortable. So the plastic fibers don't go back to the initial position or to the recoil to allow minor relapse within that stage. They stayed active until it comes time to change the aligner after 2 weeks. So one of the characteristics of this material, and the reason why it's so comfortable and flexible, is because it's made of 2 external dual shells and 1 middle elastomeric middle layer that makes everything a little bit more flexible, as at the same time as having the outside rigidity. So when the patient places the aligner in the mouth, the initial shock or click, if you've placed aligners before, you will know exactly what I mean of that click. It's not as uncomfortable or as shocking for the patient when they use it for the first time. So that's great. Also, it's very resistant to crack, and in fact is the leader in the market on these studies, and also discoloration. So whenever, I mean, obviously you don't let the patient, or you tell the patient not to eat with aligners on, but undoubtedly there will be some remnants of colorants after the patient's eaten, even if they brush their teeth. So that causes some discoloration. So it's important to have a material that offers all of these characteristics, and the patient, because at the end of the day, it's as we call it, an invisible appliance, or at least a clear appliance that the patient needs to wear without anyone else noticing. Having said that, people are getting so used to aligners that you notice it more and more anyway. But at least it's not something that is going to look discolored or dirty, and that is very important, as well as providing the forces, the constant forces that will guide or that will lead to a predictable outcome. Because of those forces being there. After that, obviously, what you need from an aligner company is treatment guidance and support. So a company that not just prints the aligners and say, well, do RPI and so on, it's a company that will give you guidance on every aspect and every element of the treatment, all the way through when to place attachments, when to do IPR, when to remove the attachments, what's going to happen when you fit the first aligner. All of that guided through the a treatment guide, and also, furthermore, giving you a treatment support, so a collaboration with orthodontic planning team. Nobody expects you to know from day one exactly where the teeth of your patient need to be. I mean, you need some guidance, and you need to know why certain cases with the spaces can be fully closed, and some cases with the spaces need to be distributed for restoration. So you need somebody there to guide you, because the patient will come in and say, I close all my spaces. And if you don't know what you're doing, you perhaps request the closure of all the spaces. But if you have a tooth size discrepancy issue, obviously you're not going to be able to do that. So you need to have that type of support. It's very important. And we also have a library of articles, blogs, and how-to videos, as well as all of these webinars like today's, recorded for you to go back and answer all the questions that you have. We've done a few very interesting topics within the aligner therapy. So I'll invite you to log in and have a look whenever you can. And if you're not at 6 Months Miles provider, as soon as you become one, you'll have the privilege of doing this and listening to all of these on-demand webinars. We have an online forum, of course, for case support with mentors and clinical instructors on the same way that I mentioned earlier to give you guidance. This one is great because it has a huge database of questions that undoubtedly you already, or somebody already had. The new question that you have in your head, somebody already asked it many, many times. So it's great to go back and, I mean, perhaps you feel shy to ask a question, but you can go through all the database and look at all the cases. Doctors upload their own photographs, their own patients' photographs, and they do it that way. So it's great. It's great database to get familiar with the orthodontic therapy ins and outs. And you can schedule virtual meetings with a clinical specialist as well. We can, you know, these days, all about the Zoom calls and the Microsoft meeting Teams, and I don't know, all the brands that are out there making a fortune. I'm just jealous that I didn't come up with that idea before, but you know, all the virtual calling and virtual consultations and so on, you can have one of those to assess whether it's potential patient to look at photographs and make you aware of the challenges and whether it's suitable for treatment or not. At the same time, or even more beneficial, if you have with treatment and something is not going right, look at that sort of troubleshooting as well. So it's very, very, very useful. And more on the aligner company selection, obviously, somebody that gives you a lead generation in terms of sending you new patients is very important, because we're only kings of our little practice, but out there, you know, there's a lot of things happening that if you have a company with a lot of global reach and local reach can give you that lead generation. So it's very important to keep that in mind. Somebody that offers you VIP treatment or perks, you know, if the more cases that you do, perhaps you can get some discounts, you can buy them up front and have a benefit on whether it's financial or educational. It's very important to consider that when selecting an aligner company. And the continuous education, doing events, having, as I said, recorded webinars or live courses, hopefully soon, will definitely be a good point when selecting an aligner company. So that's the list of what you need to keep in mind. Now, how is that going to work? How is that going to work in your practice? Aligners work in your favor in your practice to the point that they will give you better control of finishing movements, or finishing improvements. So great flexibility in the planning a restorative treatment, for example, as I mentioned earlier, and allows a multidisciplinary approach. So a lot of things can work with aligners, or before aligners, or after aligners. We'll look at them more closely. But let's just have a look at this, for example. You have a patient that, as I mentioned earlier, comes to your practice, they don't like their smile and they want veneers, because that's what they've seen on TV with all the celebrities having veneers. And of course, you need to have a plan. And with this day and age and the technology that we have, you can actually clone your patient digitally, have the teeth on a 3D model, and plan on top of that the future restorations, which is really exciting. On a software, you can manipulate, not only place the restorations, but first of all, take the teeth where you want to take them for these restorations to be even smaller or even less reduction of enamel. And that is a fantastic, fantastic tool that will make our lives simpler and less invasive for the patient. So with the help of a 3D scanning, you can make the most out of these technologies. And with the help of clear aligners, it takes you to an easier restorative approach. So it's very important to consider, from a massive veneer that would have been, you go for a very, very thin almost non-prep veneer, which is a great help in your practice. What else do they do? Well, the product speaks for itself. You know, when a patient wears an aligner and they're so comfortable, they feel very, very good in the fact that they don't have to suffer a lot of pain or a lot of aesthetic detriments, let's just say. So it's, you know, a huge brand awareness. The name of this company, it's known globally. So, you know, it's not a lab in a back room, you know, cutting 3D models one by one. It's a huge brand awareness and a huge company that will help you deliver whatever is needed in your practice. And flexibility for patients. You know, the digital approach delivers a lot of flexibility in time, chair time, obviously, visits, and less risk of emergency appointments. So it also fits into the cosmetically driven world. It's all about aesthetics. It's all about the time. You know, patients want it now. Patients want it. They don't want to wait too long. So it's definitely an appliance that fits within those realms. Not a massive performance from your side. All the work is done from the company. You just have to fit the aligners, do a little bit of removal of enamel like IPR, and bond some attachments, and that's it. So it's fairly non-invasive, and you have the advantage of the computers. I mean the visualization of the outcomes, and it definitely is a practice builder. I'd like to say that the aligner therapy equals minimally invasive therapy. So the advantages are obviously the longevity of your plan. It increases a lot because you get rid of all the traumatic contacts, all the traumatic occlusion, and more tight interproximal contacts, let's just say. The patient comfort is obviously huge because there's no single aligner that will produce enough pain even to reach for a painkiller. It's just very, very, very comfortable. The predictability, of course, when you have the guidance of the digital plan, that everything that you put in the computer will be 100% recreated into an appliance and a plastic that will provide the forces necessary to achieve that result, then it's a big advantage. Patients don't want the teeth drilled anymore. So this is a great approach to reduce that. And then obviously from that, you can move to more invasive procedures. For example, if it's a massive class 2 and you need perhaps some extraction of premolars, you know, it can be considered that, or a class 3 with a lower incisor extraction, it can happen. So let me show you a couple of cases that really fit with what I have explained previously. Patient comes into the practice, heavy crowding, mild to heavy crowding. You wouldn't really dream on doing any veneers on that. However, I've seen them. I've seen the doctors, obviously, as much as I respect them, they're very skillful. They will just put veneers on top of these teeth. Just look at the function, the occlusion on that patient. So it's biting really heavily on that upper right lateral, and you know, the position is just not great. You know, and as the patient grows older, this is just gonna get worse. So this is definitely a candidate for orthodontic treatment before you do any restorative plan, because the reality is that this patient was complaining about the shape of the teeth. She wanted to improve the shape of the teeth. As you can see, they're not amazingly aesthetic shapes of the crowns. They're very square shaped. So the point here is to make the patient understand that this case, or this clinical situation, requires two approaches. We need to get the teeth where they're supposed to be within the arch, so we restore a bit of the function, and then we need to change the shape. But once the teeth are happy happy, I mean biting in the correct positions without traumas, without heavy occlusion. The beauty of this case is that, as you can see, well, the photos are not great, but it's actually class 1, even though it looks like class 3 in the photos. It's a class 1 relationship, molar relationship. And this is where the advantage of doing an orthodontic assessment comes into play. You know, it's the posterior segment. I wouldn't really move too much the molars because it's gold, you know, that solid occlusion. So we are just facing an adult that requires some proclination and IPR to give a better outcome. So actually, I show you I put a video here for you to see the plan, how we've done it. As you can see, some sort of flashing of the IPR at some points. As you can see, the posterior segment is actually not moving that much. We are aligning the teeth by leaf rotations, by bringing the anterior segment forwards, as in proclining them, and the lower incisors retraction by IPR, and a little bit of expansion on the premolar segment, as you can see, and that will be enough to provide a fantastic result, and for the veneers to be very easily done after this, if the patient still wants them. Because I have a lot of experience where patients after this, they say like, you know what, actually, I'm quite happy with that. I don't need to go for the veneer approach. This is a great improvement. So, you know, I would like to ask all of you, I mean, would you still consider veneers without orthodontic treatment with this case? I hope the answer is no, and you see why. It's a great case. Another typical example that we get in the practice is the spacing. The patient comes to the practice and they say, I hate my spaces. And can you close them? I don't care about the posterior segment. Just close the spaces, my spaces that I have on my teeth. And of course, the first instance, I mean, will be to do an orthodontic assessment. But if you don't, and if you fall into the traps of any companies that you say, please close the spaces on this patient, then imagine what's going to happen, right? If you close the spaces on the upper arch. We have a very heavy class 2D2 with the deep bite, retroclined upper incisors, of course. So it's very constricted. The posterior segment is actually not that bad, but it's the anterior segment that is very constricted because of the incisor classification. So what we need to do, we need to bring those upper incisors into the best position possible, which is sending the roots palatally, uprighting them, and perhaps I can see a little bit of tooth size discrepancy. Perhaps full closure might not be possible. And of course, if there is not a correction of the posterior segment or the anterior-posterior relationship, we'll have an overjet increase. But I mean, that's fine. It will be better than fully closing them, or it will be better than doing restorations on the position of these teeth, because they're going to fail. So again, I put together the video of the plan that we've created for this patient. And by the way, the previous one and this one, 20 aligners or less, because that's the dual arch appliance that we use. So as you can see, the space closure on this particular case, it's done not by retraction, but by uprighting the anterior segments. And actually, you will see that the full space closure was not possible. You will see distribution of the spaces mesially and distally on the upper laterals. Why is that? Well, you could perhaps retract more and close the spaces, but then that will create an element of collision with the upper arch, with the lower arch, sorry. So you wouldn't want to do that approach, and also you might end up collapsing or making a very flat arch shape or anterior segment, very, very flat, and you don't want to do that. So you want to have a nice and round arch, and then just do a little bit of composite or a couple of veneers on the laterals. That will definitely help you close that. So from a clinical approach, I think you have gathered, I mean, we could be here all night, all day, depending where you are in the world. I'm in London, talking about the clinical situation, the clinical ins and outs of aligners. But I hope that gives you a little bit of an idea of how good of an appliance is to benefit your practice and to deliver this minimally invasive approach to your patients that we see day in, day out. So I want to move on to the benefits of the aligner therapy, and more encompassing the benefits of a company that offers certain elements. For example, patient marketing. So when expanding your practice through orthodontic aligners, obviously it's important to consider how you are going to market this new treatment option to patients. So you need to choose a world-class company, a global company who has a good social media presence and a good name that customers will relate and will find you through that. Will find you patients and bring them to your doorstep as well. It's possible. So as you know, patients these days are doing more and more research online and want the information to be done instantly. They don't want to be booking appointments and waiting for the doctor to come back to them. They want everything immediately. We have lots of information, lots of galleries for them to go through and see what we can offer. And although the patient will never interact directly with the aligner company, they will expect the company's website to answer general questions about treatment. So read testimonials from other patients, for example, see before and after photos to assist them, and then obviously finding the dentist in their area. So that's very important when doing the marketing for the patient. So what about your existing patients? These are obviously for new patients, but your existing patients also need to be sure, need to be looked after. So be sure you put up posters in your clinic and brochures in the front lobby or banners at the entrance, and showcase the treatments or before and after photos, so they know that you are providing this service if you provide it. Obviously, it's important to make them aware of what is available in your practice. So designing and printing all these materials can be quite expensive. So partnering with a company that provides you all of this, it's paramount. You know, it's great. It's a fantastic approach that you can offer in your practice. So what about the continuous education? So treatment techniques and technologies are obviously ever evolving, and selecting a world-class company offering this continued education will keep you at the top of your game for sure. Evaluate their education programs, including the live instructions, online training and webinars, on-demand videos, and how-to articles, as well as manuals and instruction guides available to you. That's very, very important. An online forum, as we mentioned before, is a great way to collaborate with other dentists, with your colleagues and specialists. You can gain advice and a lot of experience through these. And of course, we all need the CE or CPD points to continue these registrations. So, as I said, it's very difficult to compile everything in 1 hour, but thank you so much for attending. I hope this was clear enough, and please, I'm really, really happy to listen to your questions. I believe there's a couple of them. So if we have a little bit of time, I will be more than happy to answer your questions. People want to know what cases can be treated with aligners. Basically, virtually all cases can be treated with aligners. I know it's not, it doesn't really help, does it? What I would say is cases that cannot be treated with 6 months alpha aligners will be when a big anteroposterior correction is needed. So if this patient, the only way that can be treated is by changing from class 2 to class 1, it will be very hard to do it with aligners, and mainly because we're limited to 20. Otherwise, pretty much everything, I will say, can be addressed and deliver a decent result. Of course, when you have very, very heavy crowded or really extreme rotations, it will take long, so it will be out of scope. So for example, if you have a 70-degree rotation canine, I mean, it will take years to de-rotate that. But, you know, the beauty of this is take a set of photos and send it to us, and we'll be able to say, listen, this canine might not be able to fully de-rotate, but guess what? The rest can be done, and these can be masked with a veneer or something. We can take it to a level where the patient will not have a functionally compromised occlusion, and you can restore it aesthetically and then have a nice result. So virtually all cases are obviously candidates for clear aligners for orthodontic treatment. It's just to what extent, what results you can offer to the patient. So that's why. Okay. I think there are some questions that just come through. Right, it says, what do GPs report as the most challenging thing with beginning this program? I'm guessing that Dr. Thomas is referring to starting the journey with clear aligners. What is the most challenging? Well, I tell you what the most challenging is initially, is not knowing what can actually be treated with orthodontics or with clear aligners, or within your realms of non-specialist skills. And that is why it's so important to have a company that helps you on this journey. So the most challenging, I will say, is knowing what you can treat and what you cannot treat. But that challenge is actually taken away because you have a chat with us, and we'll take that challenge away. But that's more commonly the things that stop people from getting into the orthodontic treatment, just the fear of doing something wrong. And that's completely understandable. You don't want to do anything wrong to your patients, and that's why you require good support. I can tell you this right now, there is not a single appliance in the market that will be safe. As in, like, you send your impressions, they send you the appliance, and you put it on without you knowing much, and that you'll be safe. It's impossible. You need to have help from somebody to tell you this case is, requires this approach. This case cannot be treated. This can be treated this way. And not many companies, in fact, I cannot remember one company that will offer that within their appliance. You have to get external help. But I think that is the main challenge. I hope that answered the questions. That's a very, very good question here. Are aligners now the standard of care as opposed to veneers? Therefore, dentists can now be sued for not offering it as an option. I'll answer the first part. I don't think it's the standard of care now. I think it's the standard of care all the time. The difference is that sometimes we bias our treatment plans because we put them onto the what we know, what we can do, what the patient feels comfortable with, and what we can offer. But if you think about it conscientiously, an orthodontic assessment is not just to be done, or a complete assessment of the patient. It's not just to be done if you want to carry out orthodontic treatment. It needs to be done to any patient that comes to your practice and requires an appliance or a restoration. Why is that? Because you want to know if that restoration that you're going to place, how is that going to interact with the function? Is it going to be, is the lifespan is going to be long, or is it going to be small or short because of the opposed teeth? How they're going to occlude? What is that going to change? So I think, I mean, it's not something that is going to be forced onto everyone to do orthodontic treatment before any appliance. I think it's more of an ethical thought and approach. If you have the opportunity to put the teeth in the correct position, why wouldn't you? You know, if that minimizes how invasive your appliance is, why wouldn't you? Why wouldn't you put the teeth in the correct position? I think that is the more ethical approach that we need to think about. Another question, can implants be moved with aligners? No, we cannot move implants with aligners because an implant has been fused by osseointegration. So the way orthodontics work, the way that we move teeth is by using the bone remodeling system, which is it's a function that happens between the periodontal ligaments and the bone around the periodontal ligaments. So when you apply a force to a periodontal ligament, it creates or releases osteoclasts that will create a space for the tooth to move into that space and so on. I mean, I'm not going to go into detail on that, but that's why implants cannot be moved with aligners, because they're fused to the bone. There's nothing to move around them. So I hope that answers the question. Let's see if we have any more. What is the lab cost for 6MS aligner cases? I'm gonna let you. I'm gonna let my colleague Sarah answer that question for you guys, to give you all the price lists, so you know what is what. Okay, let's see. Charges, fees. Yeah, if you can refer to Sarah, that'll be good. Okay, this is a good one. I struggle with IPR requirements when treating with planned aligned trays. I'm guessing it's planned aligners. In my experience, one incorrect adjustment interferes with subsequent trays, necessitating essentially a restart. This has significantly lessened my enthusiasm for the treatment. Okay, very good. So IPR issues. Correct. You are absolutely right. IPR is one of the most important aspects to get absolutely and 100% right in your clear aligner system. Why? Because unlike fixed appliance or any other orthodontic appliance that is an open system, an aligner is a closed system. By that, I mean every single tooth is encapsulating, every single tooth is being encapsulated by an aligner. And the tooth is going to move as much or as little as that aligner allows them. So if the aligner requires the tooth to move, let's just say mesially, 0.5 of a millimeter, and for that, you need to create that amount of a space, as in IPR for 0.5 of a millimeter, and you don't create it, obviously the tooth is not going to have anywhere to move. So the issue with that is the tooth is going to either intrude or not move at all. And as you mentioned, Dr. Torres, the teeth will stop moving accordingly. So you start losing track, and then aligner 5 doesn't fit anymore, and nobody knows why they're not moving, so you need to restart. So the solution for that, I mean, and again, we can talk about IPR for a very long time. And in fact, there's a webinar that I recorded, I think back in June, May, about IPR. It's a great help. But I can tell you this very quickly. The key for clear aligners and IPR is always to measure the amount of IPR prescribed very accurately with leaf gauges. And very quickly, I'll tell you a tip of advice. Always, before you measure, once you do your IPR, let's just say that you do it with manual strips. When you do your IPR with manual strips, don't measure with a leaf gauge immediately. Let the periodontal fibers recoil. They go back to position, because if you measure immediately, you're going to have a wrong measurement, because you pressed against the tooth when doing your IPR with the strips. So you will measure more than actually is. So you end up doing less. Now, that's one tip of advice. The other one is, every time you see your patient on aligner fit, by the way, bring them every 3 to 4 aligners, pass the thinnest one of interdental strips between every single contact that shows movement. So instead of passing the floss or all this advice that you get, grab the thinnest one of interdental strips, the yellow one, and pass it literally once or twice. This is going to relieve any tightness that you may have between interproximal contacts. So again, I could spend another 2 hours talking about IPR, but there's a very good webinar that you can refer to. Okay, I think that's all for today. I believe that's all the questions that we have. Thank you very much for attending. Thank you very much for your interesting questions. I look forward to hear from you if you have any more. All the team at 6 Bond Smiles will be more than happy to answer all your questions and refer them to me if necessary. Okay, thank you and have a lovely day.